Good afternoon. Welcome to the daily briefing number 221. And the numbers are bad, so Sam, get into them.
Well, we've always tried to keep an optimistic attitude when it comes to our numbers, and we are certainly at a point today where we need to be concerned. Our numbers are not heading in the direction that we would like to see them heading. The past couple of days, we have seen our regional positivity rate continue to go up, and today is no exception. So I know that you guys think that we preach, the washing your hands, wearing your mask, watching your distance. But as we see these numbers rise, those three steps are becoming more important now than ever. So as of today, we have tested 106,502 St. Clair County residents, which is an increase of 630 from yesterday. We are at 8,541 positive test results, which is an increase of 66 from yesterday. And that does include both males and females from under the age of 10 up to their 90s. Our daily county positivity rate today for St. Clair County is at 10.5%, which is entirely too high. We hate to see that number. We would like to see it much lower than that. We are at 97,961 negative test results. And unfortunately, we are reporting 2 more additional deaths today, which does bring our total for St. Clair County to 217. We had a male in his 70s and a male in his 90s, both with unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 7,776. For state totals, 6,883,314 have been tested, with 350,875 positive test results, which is an increase of 3,714 from yesterday. And for deaths, the state is reporting 9,277, which is an increase of 41 from yesterday. For hospitalization numbers for St. Clair County, currently we have 52 individuals that are admitted due to COVID-related reasons, and 4 of them are on ventilators. And regionally, we have 98 individuals that are admitted due to COVID-related reasons, and 9 of them are on ventilators. For our congregate living facilities that have previously or are currently in outbreak status, these are cumulative numbers of cases at each facility. We have 1 facility that has had changes, and we will only announce any facilities that have had changes in cases or deaths. The Esquilin Dammert Center at the Shrine has 50 cases and 8 deaths, which is an increase of 5 cases for that facility. We do still have some testing this week. We have the 21st and 22nd, which is Wednesday and Thursday at Clair Fairgrounds from 8 a.m. to 4 p.m. on both days. And then on Saturday and Sunday, the 24th and 25th, we have testing at Belva West High School, and that is around the back of the school near the tennis courts, and that is from 8 a.m. to 4 p.m. as well. And both of those testing sites and those locations will be posted on St. Clair County Health Department Facebook page as well as the EMA Facebook page. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. We'll move into the zip code report. These are St. Clair County zip codes. These are the COVID positives in these particular zip codes, and the ones that have changed are the ones that we read. So in 62201, we go up 5 today to 274. 62203 goes up 3 to 247. 62205 goes up 2 to 230. 62206 goes up 2 to 516. 62207 goes down 1 today to 265. 62208 goes up 5 to 504. 62220 goes up 6 to 661. 62221 goes up 9 to 786. 62223 also goes up 9 to 527. 62225 goes up 1 to 37. 62226 goes up 6 to 896. 62232 goes up 1 to 225. 62239 goes up 1 today to 137. 62243 goes up 2 to 129. 62254 goes down 1 to 285. 62257 goes up 1 to 43. 62258 goes up 9 to 225. And 62269 goes up 5 to 690. As Herb said, as Sam talked about, numbers don't look very good today. The testing, we had 630 people tested, of which 66 were new positives in the county. That brings our daily county positivity to 10.5%. 7-day rolling average is now up to 6.8%. So we spoiled our record of being 6.5 or under for the whole month. But we're going to try. We're going to get better. The state has our regional positivity today up to 7.4%. And remember, if we are 8% or above for 3 days, we go back to those mitigations. So we got to watch this number closely. We don't want that to happen. The reason for the rise today, Bond County checks in at 7.3%. Clinton County checks in at 66.7%. They had 44 positive cases out of 66 people tested. That's a high number. Madison County, 9.7%. Monroe County, 10.3%. Randolph County's at 14.6%. St. Clair is a lot higher than we'd like it to be at 9.3%. And Washington County is actually, they're at a negative number today. They go down minus 9.1%, which is minus 1 positive out of 11 tested. I assume that positive was transferred to another county or had been misplaced in that county to start with. So, Herb, the numbers aren't really appearing very good. It's also interesting to note today that 31 of the 66 are either in their 20s, their teens, or under 10 years old. So that's a really high number, 31 out of 66 to be in the very young part of our population.
Yes, it is. And as Sam said, and you've said, we've been serious for 221 days, but we're at that point now where Team St. Clair has been doing the best they can. All of you that have been following us throughout the state, other regions, I think it's 1, 5, 7, and 8 are back into mitigation. So it's just not on the increase here in our region. It's everywhere in the state, everywhere around the country. If you keep up with all of that, that 7.4, we went up from 7.0 from yesterday. Each day we're seeing it gradually go up. 2 more deaths, as Sam said, up to 217 here in our county. The other numbers that is really starting to sound the warning bells is the hospitalizations. We went up from 44 yesterday to 52. Here in the county regionally, we went up from 90 to 98. So those are other metrics that we really have to watch. It's to the point where we keep preaching it, as I said we're going to. There's one thing I know for sure. Tomorrow we're going to have the CEOs of Memorial BJC and St. Elizabeth's will come on to give us some insight from the hospital's perspective, so we're looking forward to that. The other thing that I know for sure is that I'm sick of the virus. We're all sick of the virus. We know all of you are sick of the virus. But the other thing that I know for sure, it's obvious by these numbers, the virus isn't sick of us, because it's still here. If you think it isn't, just look at these numbers. And until it affects you, some of you, I guess you don't care. But it's serious. 9,277 people in the state of Illinois have died from it. And for those of you that are conspiracy theorists out there that say, they had other underlying health issues, they sure do. We all probably have some of that. But that doesn't mean if you get COVID, you have to die. And it's real simple, as we say all the time. Wear the mask. Wash your hands, watch your social distancing, and yes, we can slow the spread of it. If you don't believe it, do your own research. Don't listen to all the people out there that say the masks aren't any good, because if you believe them, then I feel sorry for you. It's been proven, scientifically proven, that the mask can help stop the spread of this deadly virus. Tell that to the families of the 217 people that we've lost. Think back to Mr. Kevin Anderson when we had him on this briefing, not once but twice. We talked to him just the other day. He's going through another surgery from what happened to him with COVID. So the long-term effects is something they don't know about. Mr. Anderson knows because he's still fighting it. Our thoughts go out to him and anybody else who has been a victim of this deadly virus. We'll be back, like I said, tomorrow with the hospital's CEOs. We'll be back with Cindy and Daisy to translate this into our Spanish communities, and we'll see you tomorrow.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and lock